the features we have in our rooms, we have these amazing baby Leo beds. These beds provide humidity for our infants. A lot of our really preterm babies, they get a lot of heat loss through their body, so we're able to provide humidity and heat within our bed to help with their temperatures. They're also, they promote developmental. We can put different nesting devices and things like that to really support the development as far as posturing and keeping those infants in certain positions so that they can develop that way. We have pull-out sofas that our mothers and dads are encouraged to come and stay a little bit with their babies, spend that time with them, getting to know them, getting to bond with them. We have breast pumps in every room, so if mom does want to pump, that is available. They don't have to bring anything on their own. They just come in and they can do that. Of course, we have the ability to store that milk and have it ready to go for their babies. We have a really wonderful lighting system in our rooms. The different colored lights, they're very pretty and they're a lot of fun, but they also have the ability to help the babies develop the cones in their eyes, so they're developing that ability to see those colors. It is not only stimulating to them, but we can also support their circadian rhythm by simulating different times of day throughout the lights. One light that seems very harsh to me at first was the red light. You know, why would a baby need a red light? But that red light is honestly one of the coolest lights that we have. It provides light and stimulation for the babies, but it does not interfere with melatonin production, so it does not interfere with the circadian rhythm, so those babies can still sleep and have that cycle supported, but they can also have a little bit of stimulation. So that's a really cool light. We have feeding pumps, we have medication pump, we have a wonderful monitor. We're able to see from anywhere in the unit our baby's vital signs, so even if we're not in the room, we can monitor the baby from anywhere in the unit, which is wonderful. We also have a twin room. The dividers between the room can be opened, and that way mom can spend time with, you know, and dad as well. Mom and dad, they can spend time with both of their twins instead of just one at a time. So that's really nice. It's really important to be able to hold your babies at the same time when you have twins. So that's a really exciting room that we have. We have an isolation room. So if we do have an infant that maybe for example has a COVID situation, we can put that baby in that isolation room and keep everyone safe, keep that baby safe. We also have some rooming in rooms that if you stay a little bit longer term, it has a shower and a bath. Our parents can go in and get cleaned up and get refreshed. I know it's really hard to be away from your home and sleeping on a couch and feeling like you just want a shower, so we're able to provide that as well.
As a respiratory therapist, we will provide mechanical ventilation. We will be doing oscillators. We will be doing oxygen therapy, assisting with high-risk deliveries, unstable babies, any baby that's in respiratory distress. We'll be running nitric oxide therapy along with that, and eventually oscillators. So that's a big difference in the level 2 care and the level 3 care. Some of the equipment that we will be using on the smaller babies that we don't currently use are therapies like nitric oxide therapy, usually in conjunction with mechanical ventilation and or oscillators. Nitric oxide is a compressed medical gas that we use to help babies' lungs develop. When they're smaller babies, their lungs aren't developed, and it just helps them oxygenate and ventilate better. So that's kind of exciting, something new that we'll be using that we don't currently use, that's majorly beneficial for the babies.
Some of the features we have here in our NICUs, we have dedicated pharmacists. They've been highly trained on newborns. It's a very specialized area, so we're very fortunate to have pharmacists right here in our unit. We also have dedicated respiratory therapists that have been trained exclusively in NICU. We're very excited to have our milk lab. A lot of hospitals don't have that service, and so we are very fortunate to have that. We also will have services as far as physical therapy, speech therapy, occupational therapy that can come in and work with our infants, help with their development. We also have a wonderful child life specialist that can meet our baby's needs. We're very fortunate to have a child life program that wants to be involved. They want to involve the parents. They're looking at possibly being able to support the siblings and having some sibling classes. So we are very excited to have all these wonderful services.